Is it possible to live with PCOS? Oh yes, of course, it is possible. Just as it is possible to live with diabetes, to live with asthma, to live with osteoporosis, and to live with all other kinds of systemic conditions. Is it possible to give birth with PCOS? Oh yes, it is possible for some women, not for all. Why? Because PCOS is not just one condition. It's a condition with between 20 to 30 different flavors. Why? Because PCOS is a combination of three main aspects. Ovulatory patterns, normal, abnormal. Insulin sensitivity, normal, mild insensitivity, or severe insulin insensitivity or resistance. And the third one is testosterone levels. Normal testosterone levels, abnormal testosterone levels. You see, there's 6 or 7 different kinds. When we combine just 6 of them, we have 15 different combinations. When we combine 6 of them, we have 21 different combinations. So it means that some of women that have normal ovulatory patterns, but, for example, increased testosterone and mild or full insulin insensitivity, they can actually give birth to children. But at the same time, their system is in disbalance. Because the normality is normal ovulatory patterns, normal level of androgen hormones, including testosterone, and normal insulin sensitivity. When these 3 things are combined, you have no polycystic ovaries. You have no cysts in your ovaries at all. If they were there and you return to a normal health, they disappear and your cycles are normal again, and there's no sign of cysts after the cycles, and there's no sign of accumulation of abnormal division of the cells outside of your uterus. So our course is about reversal of PCOS condition, and we don't work with symptoms. We work with causes. We work with triggers that trigger some of abnormalities in these 3 main aspects: ovulatory patterns, androgen hormone level like testosterone, and insulin regulation, insulin sensitivity. How do we do that? We do that because we start with entering what we call a window of opportunity. And for PCOS, there's a special window of opportunity, and it's called nutrition. And nutrition, it's not only what to eat and what not to eat. It's not only what is the balance of the nutrients, like macronutrients that gives us energy. What is the preferred source of energy? Is it fats, or is it glucose or carbs? Is it did the main switch work? And that's actually the switch in our body, where the prioritized source of energy switches from glucose to fats. Did this switch work? Or haven't you taken all the steps that push that switch to switch and to start normalizing your system? We can actually measure that. That's one of the things that we are going to learn on the course. And it's not all yet, and we're still talking about nutrition. Nutrition is also how to normalize the level of absorption of macronutrients that you used to hear, and you used to that it's necessary to take in the pill form, like magnesium or potassium, other kinds of micronutrients like minerals,